Welcome back to On the Beat, everyone. I'm over here with Dr. Cameron from the Huxford Clinic, and we're talking about vaccinations for pulmonary patients. Okay, how are you, my friend?
Very good.
First of all,
thank you.
We have you coming in and we talk all about sleep apnea, but we wanted to throw you a curveball this time round. And I think it's a super important topic, considering vaccinations are a hot topic across all platforms right now. But you want to talk more about pulmonary issues. So when it comes to that, what vaccinations are available?
The ones we give in the office are the flu shot.
Yes.
And then there's 2 separate pneumonia vaccines that are available.
Okay, well, we're going to talk a little bit about the flu shot to begin with. And we know so many people say, oh, I don't like getting the flu shot because I get sick, or when I get the flu shot, I get sick. True or false?
I would have to say false. There are some misconceptions about that, but the flu vaccine that we have today is an inactivated virus, so it should not make you get sick.
Why do people feel that? Why do people say that?
I don't know. I think it triggers your immune system, and so that might make you feel a little achy, but it's not the flu.
Okay. How often do they change those flu shots up? Because there's so many different strands all the time.
It's a guessing game. They change it every year in anticipation of the virus they expect. Some years they're better than others.
Okay, and most pharmacies, those big pharmacies, they give them away. And they're also part of your insurance.
Right. It's usually your insurance will pay for it, but you can go without a prescription to the drugstore and get one.
And if it's available, why not take it? What age should you start?
All adults should have it,
Just
18 and above, but that's who I focus mainly on. But there is a vaccine available for children. In years past, it's been a nasal vaccine, so it's not even a shot.
Okay, all right. Now, let's talk about pneumonia. I love this conversation because you said, I didn't think about vaccines for pneumonia, and you said there's 2 available.
There's 2. There's one that's been out for a long time. It's called the Pneumovax 23. That was the one that historically you would get, and then you would get a booster every 5 years.
Right.
The new one that came out several years ago is Prevnar 13. And that's typically, you don't have to have a booster shot on that one. It's a one-time.
One time only?
Right.
And what about covered for insurance?
Yes, they're both covered, and you should have both. If you've had neither, the evidence would say you would get the Prevnar 13 first, and then approximately a year later, you would get the Pneumovax 23.
I got you. Now, I heard when we were off camera also that one of our crew was asking you if they are severe asthma sufferers.
Right.
Should they get this type of shot?
Well, everyone over 65 should get the pneumonia vaccine.
Oh, she's over 65.
Yeah, she's old. But
she's not. We're going to get in a lot of trouble for saying that. But what do you say? Keep talking.
Okay. Everyone over 65 should get it, but if you have chronic medical condition and you're between the ages of 18 and 64, such as high blood pressure, diabetes, asthma, then those people should be getting the Pneumovax 23.
Okay, I got you. All right, before we go, I wanted to touch on something personal, if I may. Why did you decide to get into this profession?
I initially got into it because of the critical care aspect. It was the intensity of the moment, the life and death, but I've really enjoyed being in the pulmonary thing because people that can't breathe just don't feel well. And so there's some satisfaction in helping people breathe better.
I could imagine that, and I can see that. We appreciate you coming in. Thank you for all the information. If you want to find out more information about the Huxford Clinic and Dr. Cameron, and we do want everyone to know that our crew member is not over 65. Back after this short break, everyone. You're watching On the Beat.